Hey, good morning. Well, good afternoon for many of us, good morning for others. And I thought I'd say hello to everyone. We had a nice following, a number of comments from different people. We got to talk about something that will be the continuation of what we were talking about before last week, understanding your symptoms versus fibromyalgia. You know, fibromyalgia has so many different symptoms, but I've mentioned this before that if you have fibromyalgia, you just don't have fibromyalgia. You have other conditions, and fibromyalgia makes those worse. The problem is understanding your symptoms, fibromyalgia, from all the other conditions and so forth you may have. There's 15 different conditions that mimic fibromyalgia in its symptoms. This is Dr. Ken Muich, Stetson Chiropractic Clinic and the Fibromyalgia Wellness Center. And I must also add that so many people say, well, it's chiropractic. It doesn't work because I've been treated by chiropractic and so forth. And I concur. I admit that chiropractic is not the answer for the condition of fibromyalgia. It helps for the secondary conditions and also a little bit neurologically, as far as obviously for the problems that fibromyalgia patients have. But as far as the treatment of fibromyalgia itself, it takes more than just chiropractic treatments. Look, I do chiropractic, I do physical therapy modalities, I do license and trained in acupuncture, rehabilitation, so many other things, orthopedics. For over 30 years, I've been working with fibromyalgia patients since 1990. And not until the year 2000 did I really find an answer for fibromyalgia and the suffering of the patients that we've used so very, very successfully. But in the meantime, what I've been trying to do, this is, by the way, my live video presentation number 51. And each and every one of these have been saved, and so you can just go look back. I've covered so many different areas. This is sort of a repeat performance a little bit, because way back about a year ago is when I was actually talking about the different symptoms from different conditions that fibromyalgia patients have. Last time we talked, we covered quite a few different things as far as the confusion between fibromyalgia symptoms and other conditions. Look, if you have osteoarthritis, rheumatoid arthritis, MS, a number of other conditions, look, you're going to have symptoms that are very, very similar to fibromyalgia patients. Are they fibromyalgia symptoms, or are they osteoarthritis, or are they IBS, celiac disease, so forth and so on? Many of them cross over. And so when we treat fibromyalgia patients, we make sure we take care of the fibromyalgia. And so many, many patients actually do have tremendous improvement as far as their symptoms and their conditions concerned. However, if you have a condition such as rheumatoid arthritis, which is bone destructive, or diabetes, or celiac disease, or ear, nose, and throat, and so forth, that is separate from fibromyalgia, we may not be able to take care of that because we're treating fibromyalgia. However, all of those symptoms from those other conditions vastly improve. Their symptoms go down. They have a lot better improvement as far as their overall symptomatology and health is concerned. So what we did last time was we talked about central nervous system, musculoskeletal system, ear, nose, and throat, IBS, celiac disease, genital urinary, dermatological. A lot of patients come in with various rashes and so forth. And also the immune system and hypoglycemia. We covered all of those, but there's a number of other ones that I thought we would talk about, because the conditions that mimic fibromyalgia include all of those I mentioned: IBS, celiac disease, RA, MS, Lyme disease, lupus, migraines, which we're going to talk about, cluster headaches, hypothyroidism, diabetes, Sjogren's, the chronic fatigue, of course, and hypoglycemia. And so all of those are conditions that mimic fibromyalgia. That's why, again, that so many doctors have such a difficult time in diagnosing fibromyalgia and treating it. They might be treating just the IBS, or they might be treating the osteoarthritis, or the MS, or lupus, or headaches, and so forth. Whereas what we do is we make sure we take care of the fibromyalgia that is mimicking many of these and also making those conditions worse. So let's take a look at part 2 of understanding and differentiating your symptoms from fibromyalgia. Headaches are very, very common. Seems like everybody comes in with a headache says it's a migraine. Well, migraines are very, very specific, very intense, detailed, so forth, to the point where many times fibromyalgia patients or patients in themselves that have headaches cannot differentiate migraine from many of the other types of headaches. Look, you can get a sinus headache from obviously a bacterial infection from sinus infection itself. Usually it's involved around the eyes because that's where your sinuses are. I'm going to use my fingers. You have two sinuses here. You have two, one on each side here, and then you have two here and two here. And these are the ones oftentimes that actually cause most of the problems. The ethmoid and sphenoid, so to speak, sinuses. Those are the ones that block up and cause most of the headache in itself. If they're over here, many times you'll have toothaches, like toothache pain, but it's really a sinus infection so in itself. Now, migraines oftentimes, or headaches themselves, often are affected by a number of different things. It could be triggered by the foods that you eat, especially anything that has any seasoning, so forth. You know, a lot of times I go to the supermarket to pick up things, and there's always people that are lined up to get all of the hams and the turkeys and everything else, and to have them slice it. And so it makes it a lot easier. That way they don't have to cook a ham or a turkey or any of the other types of meat. Well, all of those have various seasonings in them, and oftentimes those can actually trigger a headache in itself. So it's better if you actually get the fresh food and prepare it for yourself. Migraine headaches, they usually come out. You usually oftentimes get some kind of a smell, or you get jagged lines across the eyes, a variety of different things that actually lead up to the migraine. Best thing to do is go into a dark room, close the doors, and if you have any meds, take them, so forth, and get out of light, because any kind of a light in itself, patients have photosensitivity with most headaches. Now, you also have something called cluster headaches. Now, cluster headaches come and go. You might have them for about 30 minutes, and then you don't have them for a while, and then they come again, and you don't have them for a while, and then they come again, so forth and so on, in bursts like that. Those oftentimes can be helped by actually massaging the back of the neck and the base of the skull. You see, the base of the skull has three major nerves that come out of it. They're called the lesser occipital, which is the back of the skull, the temporal, which is the sides of the skull itself, and then the third nerve that goes in through the base of the skull, the occiput, is called the greater occipital. And that one is really a killer. That one starts at the back of the skull and goes all the way over and into the eyes itself. So sometimes you can have a sinus headache, but oftentimes you can actually have a headache that is caused by a pinching of the nerves that go into the base of the skull. Oftentimes a ice pack at the base of the skull will really help a lot of those headaches. Look, if you're working on a computer a lot and you have problems with headaches, there's a good chance that you have what's called protraction. That's with your head forward. We're working more and more with our patients when they come in. We take a picture of them sideways. And if your ear is not aligned with your shoulder, it can cause all sorts of secondary side effects. I'll get into that. I'll do a talk on that in the near future. But anyway, so all of these things can be separate from fibromyalgia. But hey, fibromyalgia can make them worse, right? And so if you treat the basics, like I just gave you some information, that's the best thing to do. A cool pack at the base of the skull, get in a dark room, try to relax. You're taking meds that helped in the past, do so, but just get away from everybody and get away from any lighting, sunlight, whatever else, because oftentimes that can have an adverse effect. Now, there's thyroid problems. I remember when I was working with fibromyalgia patients years and years ago, decades, that thyroid was not really even considered as a problem, as a condition. But the thyroid involves so many different things in your body you take for granted. For example, weight gain or loss, energy, fatigue, muscles, also the dry skin, impairment in memory. What do those sound like? Those like fibromyalgia, right? So some of the groups where fibromyalgia also started to listen to this doctor in Kansas City, I believe, or in the Kansas area, that said, look, take thyroid medicine, take iodine, and that'll take care of your problem. Well, you just can't automatically take iodine. You got to be regularly evaluated as far as the amount of iodine, whether or not it should go up or down, so forth and so on. So all of a sudden, people got on this iodine kick and started taking iodine indiscriminately. And for some, it helped, but for others, yeah, again, it was one of those failure things that say, "Oh heck, forget it, it doesn't work." But you need to go to a specialist and get your thyroid checked out, or blood tests oftentimes, including T3, T4 testing. That's some of the blood testing that you go through to actually let you know whether or not you have a thyroid problem. And that can be treated properly so that it differentiates that from the fibromyalgia itself. But that's something, if you notice, the symptoms in that are very, very similar. Type 2 diabetes, that's where hypoglycemia comes in. And we put patients on a restricted hypoglycemic diet. We, in effect, take all sugar out of their diet, including gluten, trans fatty acids, sugar, so forth and so on. Look, most of the foods that you have automatically have sugar in them, like carbohydrates. I talked to you about low glycemic, which is so much more important than the starchy, high glycemic foods that have much higher higher sugar content. So you have that spike that comes down and it goes down. Low glycemic keeps you on even keel, so it helps you keep away from the diabetic aspect in itself. Even if you have diabetes, it's extremely important that you watch the sugar intake and also stay on the low glycemic aspect of it. So that's another answer for you as far as to be able to help you to stay away from making the secondary conditions worse while we're trying to treat fibromyalgia. Sjogren's, very, very interesting. I've had a number of patients that have Sjogren's disease with fibromyalgia. It's an autoimmune disease. It's inflammatory. It affects the glands, the dry mouth. It's something called a condition called sicca, where you just can't seem to get any fluids in your mouth and so forth. Matter of fact, it's very, very interesting, but sicca or dry mouth is very, very common with diabetes, diabetic patients. And so if you seem as though you're not having any fluids in the mouth and so forth, make sure you check that out as far as other conditions that you may have. Also, the Sjogren's involves inflammation of the tissues in itself. So make sure that, again, the secondary conditions are taken care of, just as important as the fibromyalgia. Otherwise, you're going to be very, very frustrated. You're going to be thinking all these aches and pains and so forth that you have are fibromyalgia, but many times they're not. They're from other conditions. And so you need to go to a doctor that thoroughly evaluates you, make sure to do blood tests and evaluation, or someone that you're already going to that you trust and so forth that can do that for you. The other thing is chronic fatigue syndrome, and that is oftentimes tied in with fibromyalgia. Now, there are chronic fatigue patients that do not have fibromyalgia. I've mentioned this before. However, most fibromyalgia patients have some forms of chronic fatigue just because of their heavy fatigue factor, their memory, inability to remember things. Keep in mind, chronic fatigue is a separate condition. It involves fevers oftentimes, sore throat, which is not uncommon, loss of concentration, a lot of joint pain, headaches. What do those sound like? Sleep deprivation, fatigue? My goodness, those are fibromyalgia. No, they're not. They're actually separate. It's a separate condition called chronic fatigue syndrome. And when I talk to chronic fatigue patients, it's like a vampire. No, I do not have fatigue or fibromyalgia. Great, okay, super, that's great, but you still should make sure that you take care of your chronic fatigue. Another important thing about chronic fatigue is I use the term wax and wane. It comes and goes. Okay, it comes and then all of a sudden it seems to get better and you kind of forget about it, then it comes back and so forth. Now, fibromyalgia is not like that, is it? I mean, you have it until you get treated properly, it just kind of sticks with you like glue on your skin. You really can't take care of it by yourself. You really need to get evaluated properly. So all of these other conditions, you need to make sure that you have an understanding and a functional integrative doctor that actually takes care of all of these secondary conditions that will actually help your fibromyalgia symptoms. That's what I'm trying to get at, okay? So you may have fibromyalgia, but all these other conditions and so forth, most people after the age of 40 have some form of osteoarthritis. and some other conditions. Obviously, it might be irritable bowel, or it might be MS, or it might be some other chronic fatigue, something like that. So you have to make sure that you understand that a lot of these other conditions have fibromyalgia symptoms, okay? But they are separate. They are separate. We're going to take care of the fibromyalgia for you, and we will lead you and oftentimes refer you to other doctors that can help you in these other secondary conditions. If I don't see you personally, many times people ask me questions and so forth. I do the best I can to answer, but a person-to-person evaluation is of extreme importance so that we can get a much better picture. I spend at least an hour on each new fibromyalgia patient, going over the history, evaluation, symptoms. I keep on asking questions, and that's what your doctor should do also. Not just say, well, okay, you got fibromyalgia here, take these Lyricas or Cymbaltas or Savellas or these opioids, and they'll knock you out and you won't know your feet from your head. That's not the way to do it. Really, it's not. You need to understand what you have, accept the fact that it is treatable, go to the proper people for treatment, and then that's a big part of the story in itself, okay? If you have any questions, ideas as far as subjects and so forth, please feel free to let me know. In the meantime, next week, where are we at here? Yep, it's about time. Next week I'm going to be talking about something that maybe many people didn't even realize, and that is your insurance and how to deal with insurance properly so that you don't get stuck with a big bill, or that your insurance people know exactly what the deal is, and how to handle insurance companies properly. Unbeknownst to many people, after I was teaching, I actually went into insurance, and I sold insurance for some major companies, and I'm so glad I did, because I've been on all different sides of the desk now, so to speak, and I understand the intricacies of what they're trying to do. And I always like to joke, look, you're not in good hands, and you're not buying a piece of the rock and so forth. Insurance companies are there to make a profit and to make sure that their investors are being taken care of. We're going to cover that a little bit more detail next time, and how you can handle some of these difficult situations, whether it be insurance, maybe even workers' comp, and some other cases that I've actually had to testify in. I want to thank you very, very much. Have a wonderful week. Have a great week. Don't be afraid to ask questions. You can send them through the Facebook or whatever, or whatever type of communication that you can. I'll try to do everything I can to answer your questions and take care of whatever I can concerning your concerns. Thank you very, very much. This is Dr. Ken Muich, Stetson Chiropractic Clinic and the Fibromyalgia Wellness Center. Always glad to see you back in other body parts, and enjoy this week. Have a wonderful time. Bye-bye now.